All right, so now we're moving into part 2 of chapter or unit 3, public health data and communication. So we're going to talk about how we measure the health of a population as a whole. So in one of your introductory assignments, I asked you how you would assess the health of a population. And a lot of people responded by saying, oh, well, you can get blood tests and check your blood pressure and your height and your weight. And all of these things that we actually do use to assess the health of individuals. But when we're looking at the health of a population as a whole, although we can look at those numbers on the aggregate, right? We can get statistics through NHANES, for example. Those aren't going to be as helpful to just see how we're doing overall, how healthy is our population. Oh, I just had really spicy curry for lunch. Let's go. Okay. All right. So this is the third kind of subheading for Unit 3, measuring the health of a population. What information or metrics do we use in public health to get an idea of the health of a population? So one of the statistics that has been very useful historically and is a little bit less useful to us today, at least in wealthier and higher resource nations, is the infant mortality rate. So historically, more than 10% of infants didn't survive their first year of life. So you can see in this figure here, here's your pointer. This is mortality rate per 1,000 live births. So of every 1,000 infants that were born in the early 1900s, about 100 of them, or 10%, died. So really high infant mortality rate. So this was a really big deal. And you can see huge decreases, right? And this continues, it's pretty much leveled out. It's kind of asymptotic now, but huge decreases. So this is less useful to us now because we've made huge strides in improving the infant mortality rate largely through two things, vaccinations and, three things, vaccinations, antibiotics, and improved perinatal care, so improved care of pregnant people before and after birth. There is still, however, a relatively high rate of mortality in general, worldwide, especially up until the age of 5. When we are young, we are more vulnerable to lots of things, especially infectious diseases. So in many places, they'll use mortality in people under age 5 as a way to get an idea of the health of young children. And we can look at that over time. This is, again, one of my favorite data websites, Our World in Data. And this is looking at global child mortality. So for the entire planet as a whole. And you can see that back in 1800, 40% of children did not make it past age 5. That's crazy, right? Just think about that. So children used to die frequently. And if you visit a cemetery, especially one that goes back into the 1800s, which we don't have all that much here in Wisconsin, but if you go out to the East Coast where people have been living in the United States for longer, people who use cemeteries, right, as opposed to the indigenous Americans, then you can see that infant and childhood deaths were very, very common. Lots of gravestones of young people. Yes, it was very sad. This is Oliver. Come here. All right. Oh, goodness. Oh, cats, man. All right. So, child mortality can be really helpful, but it only tells us about children. So in order to get an idea of what's going on with adults, we're going to look at life expectancy. So this is a measure of the average lifespan. So on average, how old are people when they die? Now, this is not going to be an accurate predictor of any one individual because everything is averaged in here, from the infant who died at 13 months of age, right, to the great-grandmother who died at 98. They're all averaged in here, but it gives you an idea of what's happening on the population level, right? So we can see here, for example, that Nigeria has the lowest life expectancy of the countries listed. And you might wonder, I wonder if Nigeria has as high a rate of HIV infection as South Africa. And in fact, it does. And that's one of the big drivers of their very low life expectancy, because HIV is a disease that kills young adults if untreated. So Nigeria, for this table, has the lowest one. And then we see India, the Russian Federation, Brazil, China, and here's the United States. So it's 79. We're a really high resourced country. But among similar nations, we're actually kind of low. So here's the United Kingdom. So 1 to 2 years higher than ours. Canada, higher. Japan, quite a bit higher. So we can see that there are differences in different countries. Is that because people are genetically or biologically different? No, it's mostly those other determinants of health. They're going to be different in different places. All right, so let's take a look at some mortality rates, or excuse me, some changes in life expectancy over time, because that's really interesting. Here we go. So this is life expectancy in the United States over the time listed, 1860 to 2020. And look at this. Oh my gosh, mid-1800s, average life expectancy was 40, right? Now, that doesn't mean that most people lived until they were 40 and dropped dead, right? It means that a lot of people died in childhood, remember? So like a sizable chunk of the population died in childhood. So you had all those people at age 3, age 4, and then you also had a lot of people dying at age 60 and 70 and 80, but when you averaged it all together, you came out with 40. So largely due to improvements in child and infant mortality, the life expectancy climbed significantly over the last century and a half and has continued to climb in large part then due to improvements in medical care and also some improvements in public health, as we'll talk about when we get into some specific conditions later. We can also look at life expectancy by demographic group to see which pockets, which sub-communities within our population might be having disparate health outcomes or different health outcomes. And so here we're looking at Black Americans versus white Americans. This is how the people chose to describe those populations. And we can see that Black Americans as a group have much lower life expectancies by demographic. And I will tell you, this is not because they are biologically very different, not at all. This is largely due to those other social determinants of health. We can also see in this graph a precipitous drop in life expectancy that occurred with the onset of the pandemic. So no surprise, all of a sudden we had millions of Americans dying from COVID-19 that would not have otherwise died. And so that brought our life expectancy way down. Here's another graph showing the same thing, but instead of breaking it out by the concept of race, instead they've broken it out by gender in terms of what body type people have, male-bodied or female-bodied. And you can see that in general, female-bodied people have a higher life expectancy than male-bodied people. For the most part, this is attributable to the effect of testosterone that increases your risk of heart attack and stroke. So people with higher testosterone generally have lower life expectancies in general. And here's the population average. And again, we see this precipitous drop in 2020 and 2021. You would say, well, sure, that's the pandemic. What can you do, right? That's just something that happened. But you can also look at how we compare to other nations. So this is comparing the United States to other wealthy nations. So looking at Australia and Canada and many nations in the EU. And you can see that we are an outlier. So our life expectancy has always been a little bit on the low side. Really, other countries made some significant steady improvements over the 90s and into the 2000s. We've made improvements, but not at the same rate. And then, although other countries definitely saw a decline in average life expectancy due to the pandemic, they kind of rebounded back to about pre-pandemic levels. Whereas in the United States, we have continued to decline. So this graph doesn't tell you why, right? But it tells you that, gosh, we need to look at the differences between our country and these other countries to figure out what might be going on. So looking at this data can be super helpful from a public health perspective, trying to evaluate the health of a population, and are there places perhaps where we could intervene to improve it, right? So we see in this benchmarking that we're probably not doing as well as we could be. So life expectancy is useful because it tells you when people die on average, which is a very hard and fast number, but it doesn't tell you the quality of the life that they are living. So there's another metric that we can look at, And this is called the health adjusted life expectancy. So of the years that you live on average, how many of those years are good, healthy, productive years? And so what they look at to calculate this is they look at how mobile are you? Can you get up and walk around? Can you drive? Or are you confined to bed all the time? Or can you maybe sit in a recliner, right? So what's your mobility? What's your cognition? Are you still clear in your mind, or are you suffering from dementia? Your ability to do self-care, or what we call ADLs, or activities of daily living. Can you cook yourself a meal? Can you brush your own teeth? Can you bathe yourself? Can you take care of your toileting needs by yourself? Are you in pain, right? Maybe you can do all those things, but you're really miserable with pain. How is your mood, right? Are you terribly depressed or anxious? And how's your sensory function? Are you able to see and hear? Those are the big ones. So this table shows us the health adjusted life expectancies for these different nations. And you can see that for most of them, it's about 10 years younger than the overall life expectancy. So what we can see, and it's fairly consistent among the different countries, with Nigeria being the exception, because usually people are very healthy until HIV gets so bad that then they die quickly, that it's about a period of 10 years that you are not living at optimal health before you then eventually die. So that difference between your health adjusted life expectancy and your overall life expectancy is about 10 years. And so in the United States, we can anticipate on average, most people will have a very healthy, active life for about 69 years on average, right? Some people higher than that, some people lower than that. So, maybe factor that into your retirement planning. All right, so it's how many years of good health you are likely to have. Another way to look at quality of life lived and understanding what are the things that are negatively impacting the quality of your life. So one way we can look at the actual quality of life and what are the things that are negatively impacting the quality of life that people have is to look at disability adjusted life years. So this is looking at the impacts of specific diseases or conditions on someone's overall health. So let me show you some information from one of my favorite websites that you've seen before. And right now what we're looking at is causes of disability adjusted life years globally, so worldwide, in ages 5 to 14. So this is in children after they've survived those initial 5 years, right? And so what you can see here is that some of the biggest ones are neonatal causes, right? So residua of having been born prematurely and had a lot of trouble in infancy, then those things carry over and people are left with deficits. Diarrheal illnesses are a major cause of disability in children worldwide. Typhoid fever, iron deficiency, malaria, a lot of things that we don't see here in our country are really, really common and have a huge negative impact on the quality of life of children globally. Now, this is looking at the United States specifically. You can see a huge difference, right? Those orange things got really small, and the blue things got really big. So the blue things are kind of medical problems. And so we can see asthma is huge in the United States as a cause of disability. We also see depression and anxiety, headaches, right? These are skin problems here. These are road injuries. So very different view of what are the things that are causing low quality of life in children in the United States versus globally. So let's look at working age adults. So when we look at working age adults, we see a very different picture, right? Things change depending on your stage of life. And this is in the United States, looking again at disability adjusted life years. Drug abuse. Drug abuse, drug abuse, drug abuse is by far the largest cause of decreased quality of life and function in the United States in people ages 15 to 49. Now, what you can't see over here, because my video thing is in the way and I can't make it smaller for some reason, is that the darker the color is, the more it's either been increasing over time, and the lighter it is, the more it's been decreasing over time. So problems with drug addiction have only been increasing over time in the United States in terms of their contribution to causing disability. I don't think that's a surprise to you. It's the opioid crisis, methamphetamines, all of that is a major cause of disability in the United States. Now, if we look at other countries, we're going to see different pictures. This is South Africa. We've already talked about this. Before you die from HIV, you will have a few years of disability. And so in South Africa, because there is so much HIV, it is a major cause of disability in young adults, because people in this age group are the people who are getting HIV infection and getting sick from it. We can look at another country too. Let's look at India. So India has a very different pattern as well. We don't see drugs on here at all. Well, actually we do. It's just really, really tiny, right? So the bigger ones here are road injuries. And so when you think about if you've ever traveled to India or you know anyone who has, their traffic laws and traffic patterns are very different than what we see here in the United States, and they're really dangerous. So we have relatively safe traffic laws and safe roads and safe vehicles here in the United States, in large part due to laws and regulations. That is not true in other places. So that's an interesting difference that we see there. So disability adjusted life years, a way to look at what is causing a decrease in people's quality of life. So for measuring the health of a population, the big numbers we're going to look at are infant and child mortality rates, overall life expectancy, health adjusted life expectancy, and then those disability adjusted life years. And those pieces of information can give us a lot of very nuanced and interesting information about the overall health of our population. All right, so we'll pick up with part 3 next.